Hello, and welcome to this Financial Practices for Contracting training. The subject of this video covers invoicing for authorized services. Topics covered in this training include pre-authorized services, payer of last resort, payment processing, and billing frequency. If your contract is a unit rate payment type and requires a service authorization, providers are expected to submit an invoice to the county only after receiving a service authorization. Invoices cannot be submitted until after the authorized service has been delivered. Some Hennepin County contracted services are billed to health insurance providers or other grants before county funds are used. This is what is meant by county being the payer of last resort. Before submitting an invoice to the county, your organization should exhaust other reimbursement options. If third-party billing is available for the person receiving services, that party is invoiced first following their procedures. This may include billing private insurance, Medicare, Medicaid, or other grants. In situations where third-party payers only reimbursed a portion of the cost of the services, providers may notify and bill Hennepin County for partial payment to make up for the difference in the cost. For services that may be eligible for third-party billing through insurance or medical assistance, a best practice is to ask persons receiving services to present their insurance card at the point of intake of the service. When clients experience a lapse or change in health insurance coverage, the county should be notified by submitting a change authorization request. Service authorized invoices are submitted electronically through a portal using a Hennepin County provided template. On the invoice to the county, providers will need to list the person's name, service authorization number, dates of service, and number of units of service provided during the billing period. When providers receive payment from Hennepin County, they should be sure to review the remittance advice for necessary corrective action on future invoices. Individuals are pre-approved for services with a maximum number of units that can be billed. Providers should track units billed so that more units can be requested if needed prior to overbilling for units exceeding the pre-approved amount. Supporting documentation for tracking the number of units to bill should be referenced when preparing service authorized unit rate invoices. Your organization must maintain any supporting documentation used for invoicing, which can be submitted or reviewed by the county per request as part of an in-depth invoice review. Examples of documentation to support unit rate billing may include case files, data system for tracking staff time for specific types of services, and sign-in sheets. Non-compliance with contract provisions may cause delays in payment. Providers should stay on top of submitting invoices in a timely manner, which is defined as within 30 days of the end of each month of services provided. Hennepin County may refuse payment if invoices are received after 90 calendar days from the last day of the month of service or after 90 days from the date the county is determined to be the payer of the last resort. Providers should avoid billing delays by ensuring that invoices are submitted within the 90-day period. Additional information on preparing invoices can be found online in the Provider Invoice and Payment Guide for Authorized Services, which is available on the Hennepin County webpage. If you have questions or need more information, please reach out to your assigned Hennepin County contract manager. Thank you for your time.